Decompressing the lumbar spine. This is one of my very favorite techniques for decompressing the lumbar spine. Okay, so when you forward bend, what happens? The lumbar vertebra, the superior vertebra glides forward on its inferior neighbor in order to cause you to forward bend. Well, we're going to want to try to do that, but we're going to do it in a different way. Instead of forward bending the trunk, which is kind of hard to do, we're going to get hold of the sacrum and drag it back. Can you see how that's the same thing as forward bending? Dragging that thing into counter nutation, the sacrum into counter nutation, is still dragging the sacrum away from L5. Most operated on disc in the body is what? L5S1, followed by what? L4, L5. You know, got to get decompression in there. This is the very best way to do it, I think. So I've got her already kind of set up in this position. Here's the key thing. Watch what you're using here for a lever. Depending on table height, you want to kind of use your hip. You don't want it in your crotch. You don't want any of that stuff. You want to get it up here like this so that it's all comfortable. Everybody's happy. So I'm just going to do this a couple of times to let her know what I want to do. And then I'm going to come in and do the decompression in two different ways. So here we go. So I get her up to barrier, about right like that. And then I'm going to come in with my body. I'm going to actually move her up onto my belly here. And now, grabbing hold of that sacrum, right? Now watch. As I move my body, step onto my left foot, I drag the sacrum down while I'm trunk flexing her. So here we go. Trunk flexion, drag it down. Trunk flexion, drag it down. Trunk flexion, drag it down. I'm going up the spine a little bit. You can be pretty vigorous with this. Not going to hurt them. Okay. The other way to do it is to come on in here, be a little more specific. You can let that arm relax. Now I'm going to come in here. Now I've still got her with my belly, right? But now I'm going to actually get specific. I'm going to come down to L5S1. I'm going to come down to L4-5, and then I'm just separating each one of the lumbar joints, moving up. See how I'm doing this? Finger on one side, index finger on one side, middle finger on the other side, both on transverse processes, and you're just decompressing all the way up. Some people will not be able to do this on because of your size or their size, but if you can, it's a fantastic technique.